to master the avatar state, you must open all the chakras. Tell me everything you know about chakras.
What are chakras?
Oh, I see. I guess we'll start with the basics.
Be jamming every time I come in this bitch. Some bitches, I guess I'm the one in this bitch. Be real stiff, be funny this bitch. Louisiana warm formula bit.
Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. So this is a serious problem. We should be concerned. But in fact, we can build a really good response system. We have the benefits of all the science and technology that we talk about here. We've got cell phones to get information from the public and get information out to them. We have satellite maps where we can see where people are and where they're moving. We have advances in biology that should dramatically change the turnaround time to look at a pathogen and be able to make drugs and vaccines that fit for that pathogen. We need to do simulations, germ games, not war games, so that we see where the holes are. The last time a germ game was done in the United States was back in 2001, and it didn't go so well.
On June 22nd, 2001, the United States government began Operation Dark Winter. Operation Dark Winter was not a war game. Instead, something more unusual. Dark Winter was a germ game. In 2001, the US military, government, and media launched a mock battle against pathology. The premise was simple. A bioterror organization released a deadly virus into the country, and smallpox is spreading quickly. The US government must now react to contain the outbreak and stop further harm. How did we do? The results were disastrous. Within 48 hours, the government failed its objectives. The loss of human life was high, and when Operation Dark Winter ended 3 days later, a summary of recommendations were given to implement across different levels of government to better prepare in case of a future Dark Winter day. In Baltimore, Maryland, in a house 5 blocks south of the Capitol, in 2018, Operation Kreated began. The scenario was similar to Dark Winter. This time, an influenza outbreak has occurred in Venezuela. It is likely to reach the US in a few days. The government must react. The simulation ran for 5 days. Day 1 began with preliminary reports and the government grappling to respond to uncertain information. Day 3, the sickness was confirmed in the United States. Day 5, the simulation ended. The process is fascinating, and there's a lot to dig into. But one interesting note is that Kladex was documented. There are recordings throughout the entire Germ Game, and I recommend you all dig through their archives to learn more. On December 20th, 2019, a year after Kladex, China began to report a new form of coronavirus in the Hebei province. Transmission rate and mortality were unknown. However, in the following weeks, it would be called COVID-19.
Dubbed it COVID-19.
New data from China now indicates the coronavirus is infecting people with the blood type A at a much higher rate.
These pools are like our chakras of separation.
The pandemic has disproportionately impacted on blacks, Latinos, and Native Americans, who are about 4 times as likely to be hospitalized and nearly 3 times more likely to die from the COVID-19 pandemic than white Americans. The cases will continue to mount. We didn't get into this mess overnight. It's going to take months for us to turn things around. Today, I am unveiling a national strategy on COVID-19 and executive actions to beat this pandemic. Our national strategy is comprehensive. It's based on science, not politics. It's based on truth, not denial, and it's detailed. You can review this entire plan, by going to whitehouse.gov. It is so detailed, it is over 198 pages. And for complete detail what we're going to do. Our plan starts with mounting an aggressive, safe, and effective vaccination campaign to meet our goal of administering 100 million shots in our first 100 days in office. We're on day 1. This will be one of the greatest operational challenges our nation has ever undertaken. And I'm committed to getting it done. We're committed to getting it done. And as I explained last week, we'll move heaven and earth to get more people vaccinated for free and create more places for them to get vaccinated, to mobilize more medical teams to get shots in people's arms, and to increase vaccine supply and get it out the door as fast as possible. These scientists carry the hopes of our nation, our entire nation, and the entire world. When their work comes to fruition, and it will, there will be no doubt it will save lives. But scientific breakthroughs don't care about calendars any more than the virus does. They certainly don't adhere to election cycles. And their timing, their approval, and their distribution should never ever be distorted by political considerations. They should be determined by science and safety alone. A vaccine would offer a way back to normalcy and a path toward better days for all of us, not only here but around the world. But it's not going to happen overnight. Once we have it, it's going to take months to distribute it to the entire population. I'm more hopeful than ever in the power of science to get us there. One thing is certain, we can't allow politics to interfere with the vaccine in any way. Americans have had to endure President Trump's incompetence and dishonesty when it comes to testing and personal protective equipment. We can't afford to repeat those fiascos when it comes to a vaccine, when it occurs. The stakes are too high. American families have already suffered and sacrificed too much. So let me be clear. I trust vaccines, I trust scientists, but I don't trust Donald Trump.
I am confident in the decisions that are being made related to COVID-19 and that will be made in the coming months as we continue to address the challenges of this pandemic. Now, I know there's been particular attention paid to a few of the decisions reached by FDA over the past several months. I want to assure you and emphasize that every one of the decisions we have reached has been made by career FDA scientists based on science and data, not politics. Often we must make real-time decisions based on ever-evolving data concerning a previously unknown, highly contagious virus that we are still learning about. And sometimes it is necessary to reverse decisions as new data emerge. This is inherent in the emergency use authorization process, otherwise known as EUA, and it is akin to how a doctor might approach a patient in an emergency situation, constantly updating a treatment plan as new data emerge. When a vaccine sponsor reaches the conclusion that the data from its phase 3 clinical trials are adequate to submit to FDA, they will decide whether to apply for approval or emergency use authorization. This will be based upon the trial meeting pre-specified success criteria that were established by that sponsor. Now, this is really important. They should also be consistent with FDA recommendations regarding those criteria. FDA will receive that application or submission, and our career scientists will review it, safety and efficacy data, as well as manufacturing quality and consistency data. FDA made clear recommendations in our June 30 guidance regarding the safety and effectiveness of vaccines. As we've indicated previously, we plan on seeking advice from the Vaccines and Related Biologics Products Advisory Committee, comprised of independent members who have been screened for ethics conflicts. The safety and effectiveness data and the committee's decision will be public, although we will need to adhere to confidentiality requirements. The public will have an opportunity to comment. The process will be transparent and independent. FDA career staff will then take the committee input into account as they make their decisions regarding the application or EUA request. Now, before we were to issue an EUA, if that were to happen, FDA would have to determine, among other things, that the statutory standard is met. We expect that this would be demonstrated based on adequate manufacturing data to ensure a vaccine's quality and consistency, and data from at least one well-designed phase 3 clinical trial that demonstrates its safety and efficacy in a clear and compelling manner. FDA also expects that an EUA request would include a plan for active follow-up to monitor safety among individuals who receive the vaccine. In the end, FDA will not authorize or approve a vaccine that we would not feel comfortable giving to our families.
I want to ask you, in that pledge last week that 9 drug makers made together, putting science first in this process, part of that pledge is to only submit for approval or emergency use authorization after demonstrating safety and efficacy through a phase 3 clinical study designed to meet the FDA's requirements. What do you require to see in the data in order to feel comfortable submitting this for clearance?
You need to see a statistically significant difference between the control arm that they're getting placebo and the vaccinated arm in the primary endpoints, which is basically to control the disease.
And the FDA has suggested 50% benefit or more. Is that the threshold that you would be looking for?
Yeah, absolutely. I don't think below 50%. I think the 50% is a good rate, and we are striving to get higher than that.
So tell us about your decision to expand the trial to 44,000 participants from 30,000 participants. Does that indicate that the current pace of the trial wasn't meeting your expectations in terms of diversity or the infection rate in the trial? What should we take away from that?
No, it's exactly what we said also in the press release, Meg, that we have already almost done with the 30,000 people, and now we have a very good appreciation of the safety profile of the product, much better, and we are very comfortable now. So we are going to much more vulnerable population. We are going to 16 years old kids. Right now we are recruiting only from 18 to 85, now we go to 16. Also we are going to people that have chronic conditions, very vulnerable situations like HIV patients. And also we'll use it to increase diversity.
My question is about the coronavirus vaccine, or potential. Senator Harris stated that she absolutely would not take a vaccine from President Trump. And of course, we all know it's not President Trump that would create this vaccine. It would be doctors and scientists that presumably we all trust. So my question for you is, if a vaccine were approved between now and the end of the year, would you take it? And if you were to become president, would you mandate that everyone has to take it?
And now Regeneron is the answer. That's going to cure everything. There's 500,000 doses. We got a couple, we have more than a few million people. And most of if you notice, most of the companies who are developing these vaccines are working, they're making real progress. I meet with 4 leading scientists at least twice a week in the beginning, 4 times a week, giving us the detail on what kind of progress is being made. And right now, they do the right thing. When they run into a serious problem, they halt the test. They don't continue until they figure out what the problem was. And in the meantime, what I worry about is the same thing with Regeneron, which is a useful a useful tool. But what's happening is, there was no plan to figure out how to distribute it. How many, we have 500,000, vials of it. Well, we don't have all the testing equipment. We don't have all the ability to get it to the people who need it.
And once we get it, if it's safe, if it's effective, will you mandate its use?
The answer is, depending on how clear, there's vaccines, they say, have a very positive impact, and they're going to affect positively 85% of the American public. Or there's others say this vaccine is really the key. This is the golden key. It depends on the state of the nature of the vaccine, when it comes out, and how it's being distributed. That would depend on. But I would think that we should be talking about, depending on the continuation of the spread of the virus, we should be thinking about making it mandatory.
How could you enforce that?
Well, you couldn't. That's the problem.
Demonstrations engulfing France, Germany and Italy as police clash with protesters over the tightening of COVID restrictions. There are reports that one protester too in Germany's collapsed and died later in hospital. Since early July, daily infection cases in Western Europe have remained relatively low, but they are still on the rise.
seen these protests across Western Europe, particularly in France and Italy and here in Germany, as well, as people are unhappy with COVID restrictions that are being put in place, and particularly when it comes to requirements or potential requirements for what's being called the EU Green Digital Pass, a digital vaccine certificate, if you will. Now, those demonstrations across Western Europe, they turn nasty at times over the weekend.
It's like you can't mandate a mask, but you can say, you can go to every governor and get them all in a room, all 50 of them as president, and say, ask people to wear the mask. Everybody knows.
And if they don't?
And they don't, no, not fine. Then I go to every governor, I go to every mayor, I go to every councilman, I go to every local official, say, mandate the mask. Say, this is what you have to do when you're out. Make sure you encourage it being done. Look, George, you and I know, and I think you do too as well, the words of a president matter.
Absolutely.
No matter whether they're good, bad, or indifferent. They matter.
This is a text conversation I had with a doctor on March 12th, when only 7 known cases of COVID-19 existed in New York.
Morning, one of the doctors featured in an out-banned viral video about the coronavirus is speaking out.
Of course they think I'm dangerous because I'm speaking truth.
Monday that featured a group of doctors claiming without evidence that there's a cure for COVID-19. In the clip, Emmanuel pushes hydroxychloroquine as part of a cure for the disease, a view largely discredited by health experts. The president retweeted the video, which was eventually taken down by Twitter, Facebook, and YouTube for violating misinformation policies.
I was very impressed with her and other doctors that stood with her. I think she made sense, but I know nothing about it.
I don't know why people are getting crazy about this.
Well, that's a minority view on whether or not it's a cure, that's
let
for
me tell you
sure.
something. When you have seen 300, 400 patients and none of them has died, it is not a minority view.
Beyond her controversial coronavirus claims, Dr. Emmanuel has also drawn criticism for her beliefs about demon spirits and disease.
It's off the beaten path to say that demons are sleeping with you overnight.
But demons are sleeping with people.
Are they?
Yes! Demons exist.
First conversation after it's authorized. Let me wish my congratulations to you.
Thank you very much. And indeed, it was like yesterday that we had this discussion.
Have you taken the vaccine, sir?
No, I haven't taken it yet. And we are having an ethical committee dealing with the question of who is getting it. And given that there are very strict allocation rules that the CDC has voted, we are very sensitive not to cut the queue and have people getting vaccinated before. So still, I think this committee recommends that I will get vaccinated. because polls that we have seen said that people will believe much more on this vaccine if the CEO is getting vaccinated. So likely I will get it.
While Mr. Biden said he would be willing to get a vaccine, he would not require it for all Americans.
I don't think it should be mandatory. I wouldn't demand to be mandatory, but I would do everything in my power. Just like I don't think masks have to be made mandatory nationwide.
New cause, and that's to address the concerns we have in our healthcare facilities throughout the state of California. But as it relates to leading by example, 246,000 Californians are state employees. 246,000 Californians should be vaccinated. And if they're not vaccinated and cannot verify that they've been vaccinated, we are requiring that they get tested. California is committed to vaccination, verification, and or testing on a...
The key to NYC Pass will be a first-in-the-nation approach. It will require vaccination for workers and customers in indoor dining, in indoor fitness facilities, indoor entertainment facilities. This is going to be a requirement. The only way to patronize these establishments indoors will be if you're vaccinated, at least one dose. The same for folks in terms of work. They'll need at least one dose.
I stress we must look toward the future, prepare for pandemics on the horizon. They are not a question of if, but when.